Hi, my name is Emma.
Hi, I'm Hannah.
Hi, I'm Carly.
And I'm Emily, and today we're going to be teaching you about pharmacological pain management during labor. Here are the objectives for this video. Objective 1. By the end of the video, Mom will be able to understand at least 3 common labor pain management options, how they work, when they are typically used, and how they may affect both mom and baby. Objective 2. By the end of the video, Mom will feel comfortable in making informed decisions about pain management options by having her most common questions answered in a clear and supportive way.
We are so glad that you're here. Whether you are expecting a baby soon or just exploring your options today, we'll be walking through some of the pharmacological options for labor pain. That just means that medications that can help ease your pain during labor.
We know that labor looks different for everyone. Some people want a natural birth, some want medication, and some just decide as they go. There's no right or wrong, it's all about what's best for you. We're just here to make sure you feel informed and empowered to make those decisions.
Labor pain can be intense, but thanks to modern medicine, there are safe and effective ways to manage it. Pain relief can help you stay more comfortable, conserve your energy, and focus on the birth of your baby. You deserve to know what your options are, so let's dive in.
Let's talk about systemic opioids. These meds are usually given through an IV or an intramuscular injection, which means that they go into your bloodstream and work throughout your body, not just one spot. They don't take the pain away completely like an epidural might, but they help by dampening your perception of pain. So contractions still may be uncomfortable, but they feel more manageable and you might be able to relax a bit more in between.
This kind of medication is most commonly used in early or active labor, especially if an epidural isn't needed yet or if you're waiting on one. It's a good option if you're looking for short-term relief. One important thing to know is these meds can cross the placenta and reach the baby, which is why your provider will carefully consider when and how much to give. If you're close to delivery, they might hold off or offer another option to avoid any effects on the baby's breathing right after birth.
Hi Emily, my name's Emma. I'm your nurse educator today, and I'm here to answer any questions you have about IV pain use. Do you have any off the top of your head?
I do. I have a couple. The first one being, is that just going to completely knock me out?
No, it won't knock you out. It'll just make you feel a little groggy or kind of drowsy. A lot of people describe it as feeling very relaxed.
Okay, and then my second question is, if I'm going to be super drowsy, is it going to make my baby really sleepy too?
That's a good question. If it's given too closely to delivery, it can make your baby a little bit drowsy, but your team will time it so that doesn't happen.
Okay, and then lastly, will I still be able to walk around while I'm in labor?
Yes, you'll still be able to walk around. You might be a little bit dizzy like I mentioned before, but we'll be there to help you, assist you to the bathroom or wherever you need to go.
Okay, thank you so much.
Let's dive into one of the most well-known options for pain relief during labor, the epidural. An epidural involves placing a small flexible catheter into the epidural space in your lower back. This is done by an anesthesiologist who is trained specifically to perform this kind of procedure.
Once the catheter is in place, medication is delivered continuously to block pain signals. And here's the great part. It can be adjusted as your labor progresses. That means your dose can be fine-tuned depending on how you're feeling. An epidural provides strong, ongoing relief. You might still feel some pressure during contractions, but the sharp pain will be greatly reduced or even go away completely. It's a great option if you're looking for long-lasting comfort and want to be awake and alert for delivery.
Okay, now do you have any questions about epidurals?
Yeah, I have a few. Will I not feel any pain at all then with an epidural?
It won't be painful, you'll just feel more like pressure, but it won't be that sharp or stabbing pressure that you would usually feel.
Okay, and then my next question is, will I be able to move and get out of bed?
Unfortunately, you'll have to stay in bed after this just because it can make you really dizzy and a lot of the times you can't feel your legs, but your support person or me can help you move around or need anything.
Okay, and then my last one, is this safe for me and my baby?
Yes, it doesn't go directly into the bloodstream, so it won't affect the baby directly.
Awesome, thank you so much.
Now let's talk about spinal blocks. A spinal block is a one-time injection that goes directly into the spinal fluid in your back. This might sound intense, but it's a very common and safe procedure done by an anesthesia provider.
The effect is fast and powerful. You'll feel immediate and complete numbness from about your chest or belly down. It's not something that can be adjusted once it's given, but it provides strong pain relief for a short period of time, usually about 1 to 2 hours. Because of that, spinal blocks are most often used for planned C-sections or sometimes for very quick vaginal deliveries where fast, full pain control is needed.
Okay, do you have any questions about spinal blocks?
Yes. My first one is, will I be completely numb?
Yes, you'll be completely numb for this from the belly down, so you won't be able to move your legs at all.
Okay, and then my last question is, will I be awake to meet my baby when I give birth to them?
Yes, you'll be fully awake unless something unexpected happens during the delivery, which makes us have to sedate you more.
Okay, thank you.
Let's talk about the combined spinal epidural, sometimes called a walking epidural. This option actually combines the best of both worlds. You get the fast pain relief of a spinal block, and then the longer lasting comfort of an epidural.
Here's how it works. First, a small dose of medication is injected directly into your spinal fluid. That gives you almost immediate relief, which is great when labor pain is getting intense quickly. Then an epidural catheter is placed to keep the pain relief going for the rest of labor. This is often used in early active labor or if your pain starts ramping up faster than expected. It's a great choice if you want relief right away, but still want the flexibility to adjust your medication as labor progresses.
Okay, hi Emily, do you have any questions about the combined spinal epidural, also known as the walking epidural?
Yeah, does that mean I'll actually be able to walk?
So the name is a little bit misleading. It doesn't mean you'll be able to walk, it just means that you're gonna have a little bit more muscle control, but you'll still need to stay in bed for safety reasons.
Okay, and then how fast does it work?
It works within minutes actually, and then the epidural will last all throughout your labor to make you comfortable. Okay, Emily, do you have any more questions for me today?
I do not.
Perfect, thank you so much for coming in. Do you feel better about making an informed decision for your pain management during labor?
Yes, I feel so much better.
Perfect, okay. If you have any other questions or concerns, don't hesitate to reach out to the office. We're always here for you to answer your questions.
Okay, thank you so much.
Thanks.
So after watching this video, you may be wondering which option is the best. But to answer that question, that completely depends on you, your preferences, how your labor is progressing, and how you're feeling in that moment. It is ultimately up to the mother to decide how they want their labor to look. Your care team is here to help you, to talk you through those choices. And remember, it's okay to change your mind. And even if things change or deviate from your plan, that's okay too. The most important thing is that you feel informed, supported, and safe. Labor looks different for everyone, and there's no one right way to manage pain.
Thank you guys for watching. We hope this gave you a helpful look at your options for pharmacologic pain management during labor. You've got this!